Oftentimes, the training health professional never gets a chance to see in real time human anatomy, human histology, and even human organ systems as it relates to real clinical scenario. So what I want to show you, this is, and we oftentimes don't get to see pediatric organs. And this is lung from a pediatric patient, EGA of 28 weeks. And this is very normal looking lung. You see alveolar spaces, you see developing bronchus. All of this is completely normal for this gestational age of 28 weeks. Now I want to show you another area of the tissue that actually shows some pathology that correlates with what I think is going on with this baby. And that is, you can see, we had shown you the autopsy showing hemorrhage in the thoraces, and you can see how it correlates here. You can see some slight hemorrhage along the pleura, and that's real. That's not post-mortem. That's actually real hemorrhage along the pleura. And we'll see what all that is about as we put the whole story together. And you can see a little edema along the pleura as well. So, but otherwise, the lung maturation is very normal. We're going to go to show you the heart next. So we're looking at heart muscle tissue too at this point, EGA of 28 weeks, but that's ventricular myocardium heart tissue. As you can see, is very normal. And you can see a little blood clot here. I wanted to go down to show you that you can see even in this blood, little blood clot there, you can see some nucleated red blood cells. If I can get it to go in focus. It's hard to kind of keep it stabilized because I'm still trying to work with this my gadget that I have for my doing telepathology. But those, let me see if I can go down. Maybe I can go down and convince you that there are some nucleated RBCs and mixed with those the neutrophils and other cells. But you can see the rounded cells; those are actually nucleated RBCs, and there are some lymphocytes in there as well, but quite a bit of nucleated RBCs. But I want to go back quickly to a lower power to show you that this heart muscle is very normally developed. There's no problem here with this heart development here. Okay, so we're going to go next to show you, let me see, the liver. The liver has a significant finding in it. So we're looking at the liver. You can see that there is a little slight extravasation of red blood cells along the cortex of this liver. But it's going to go in and out of focus, but I promise you'll see the gist of what I'm trying to show. But even on this low power, you can see that there is extramedullary hematopoiesis, and I'll convince you once we go down, but this is liver tissue. I know it kind of looks like spleen, but I can promise you this is liver. And I'm going to convince you when I go down even to a lower power, closer view, to show you, first of all, this liver is adequately developed for this EGA of 28 weeks, but there's extensive extramedullary hematopoiesis as I get it to come in focus again, and you can see as it comes. But I want to go even closer to show you that indeed that's extramedullary hematopoiesis involving this liver. If I can get it to stay in focus here. It gets a little more tricky to stay in focus with my little gadget here, but that's beautiful right there. So be patient with me as I scan around. You'll see that that's extramedullary hematopoiesis, quite extensive in this liver, to show you that this little baby was in some serious trouble. In fact, it was making quite a bit. Now, normally at this age, the liver does make play a role in making red blood cells, white blood cells, and platelets. But you can see here that there is such a preponderance of erythroid precursors in this aspect of the extramedullary hematopoiesis. If I can get it to stay focused, be patient with me. Maybe I need to get a gadget that can stay fixed for me instead of moving around here. But you can see that there is extensive extramedullary hematopoiesis with a preponderance of nucleated RBCs as to suggest that the baby was having some difficulty with perhaps anemia, intrauterine anemia, and that oftentimes goes with hydrops fetalis. But of course, we have to look at other avenues. There's a little megakaryocyte right there in the center there. So, but we have to look at other parameters to make that diagnosis of non-immune hydroxyl fetalis. And I say it's non-immune because the mother was RH negative. So this is, I think she was RH. I can't remember I know she was compatible with the baby. So, but I have to see that by history. I mean, by the chart, because obviously this is what was gathered from a discussion with the family. But we have to make sure we get the records to make sure that that the baby wasn't reacting to the mother immune system or red cells, some sort of incompatibility that way, versus reacting incompatibly with perhaps transfusion from twin A. Okay, we'll make more sense out of it as we continue to discuss it. So now here we're showing the spleen, and this is adequate maturation for the spleen. You see the red and white pulp, very normal histology of the spleen in this baby at EGA of 28 weeks. Very normal, nicely developed spleen, very normal. Okay, so we're going to go and show you the kidney next. No, before I do that, I want to show the pancreas next. It was very normal too. So we're looking at the pancreas here. As you can see, it too is very normally developed. There's absolutely no abnormality with this pancreas. As we just peruse around for you can see the overall pattern of this pancreas. Very normal pancreas, okay? And I'll just go down probably just to show you the closer view, because I just love the histology of the pancreas. Such a beautiful organ from a histology standpoint. This is very normal pancreas here. And it's good. There is a little peripancreatic lymph node, very benign and reactive. And there's another one right next to it. It's another, those are two lymph nodes there. There's another lymph node. So there's a little lymphoid hyperplasia here. I'm not sure what that significance is, but very normal looking pancreas, okay? So as we look here, we're looking at the thymus. The thymus gland is also another beautiful histology that we look at. If I can get it to stay in focus, it's going to go in and out of focus because I'm videotaping in real time as I try to talk to you. But this is beautifully normal thymus. And this is a good idea, particularly for those who are training in histology and medicine and pathology and stuff, to kind of understand what normal lymphoid tissue looks like. This is going to help you when you're trying to diagnose lymphomas and thymomas and stuff, to get a good idea what the normal histology looks like. This is just perfectly normal and adequately developed thymus, okay? And I just like to look at it. So let me go down one more power so you can see the cells up close, what the thymus tissue entails. You can see the Hassel corpuscles. Beautiful. It's beautiful histology there, y'all. Okay? Normal thymus. So we're showing you normal kidney now. This is beautifully normal kidney. I'm going to go to a lower power so you can see how nicely, normally developed this kidney is. Very normal kidney, pediatric kidney in a baby EGA of 28 weeks. Very normal, just beautiful histology. Again, this is where you're going to understand pathology by studying what the normal looks like. And obviously this is a pediatric kidney, so this is not an adult kidney. So you're going to see some, obviously younger looking cells in this kidney. But this is very normal. Look at the glomeruli, the tubules in between the glomeruli, normally developed in this baby of EGA 28 weeks. Normal. This is good histology. And so this will be all cortical, and then we go over here. We start getting into the medullary component with the collecting ducts, and almost to the pelvis as well, calyces, so forth and so on. Beautifully normal histology. This is where you want to study when you're trying to understand pathology. Study the normal, and then I think you can appreciate the pathology once you understand the normal. Okay, so we're going to go back. I'll go over to another organ system to show you on this baby EGA 28 weeks. So we're showing you the normal appendix again, baby EGA 28 weeks, and I'm going to go over here too. This is a trans section of the kidney, a longitudinal section rather of this kidney I'm sorry, I don't know why I said kidney. I guess I just finished with the kidney, but this is still appendix, longitudinal section, very beautifully normal histology, and it also almost looked like colon a little bit, but this is appendix. I can assure you this is appendix. And let me see if I can go. I'll show you the other intestine next. So here we're showing stomach, and there's another lymph node, a perigastric lymph node. So there is definitely some lymph node hyperplasia in this baby EGA 28 weeks. This is all normal looking stomach here. Let's see. Let's go back over this way. That's normal stomach. And if you go here, and that's probably the esophagus. If I can show you the lining first, there is the squamous esophageal lining there. Squamous mucosa of the esophagus, very normal esophagus. And let's see what else is on this particular. Okay, that's more perhaps stomach. Yeah, I think this is section with esophagus and stomach. And that's a little duodenum there, at least the surface of the duodenum, junction with the stomach. So this is our stomach here. Okay, so we're showing this to show you the histology just in general. That's more esophagus. I thought I had a larger stretch of esophageal tissue, but most of this is stomach. And as I continue to peruse around, there is another longer stretch of the esophagus with some mucus glands in the wall of the esophagus there. But very normal. It's beautifully normal histology. Again, study pediatric histology, adult histology, and it's going to help you really understand general pathology when you understand normal histology. Thank you. So here's histology of the colon, the large bowel, and that's perfectly normal as well as I've shown you before. Let me see if I can go over. That's beautiful histology, a longitudinal section of colon. If it comes in and out of focus there. Let's see if I can go down even closer. But that's beautiful, and you can see how the histology is preserved even in this neonate EGA 28. And I think the baby had been dead for like 2 days, so the cells are still preserved. Very nicely normal histology. Again, this is where you're going to understand pathology by understand what normal histology looks like. You see even two layered of the muscle complex, the muscular propria complex there. Okay, alrighty. And finally, it's always good to take a section of bone so you can see the normal maturation. I'm going to go over where the cartilage is so you can see some actual osteogenesis there with some rimming by the osteoblast there, remember, and the medullary component there. And if I can go over, I think I have some cartilage with it. So here's some bone there, and then you see the cartilage rim there as it develops and mature. So this is good histology, good embryology. To kind of put it in perspective for you, the little skeletal muscle there. This section was taken from the ribs. So you're going to see bone, cartilage, and I think we can go over to show you some bone marrow in this section of bone. So that's bone marrow tissue. So there's a lot of good learning stuff in this one slide. I'm just going to go even to a closer power view to show you how nicely preserved even the bone marrow cells are. See? And people often say, well, the autopsies don't give you much to learn from, but as you see here, you can learn quite a bit by studying tissue from an autopsy. Okay? So that concludes this presentation. Thank you for listening, and hopefully you've learned something from. And finally, brain tissue. Look how nicely developed the neurons are, the nuclei of this. And nice maturing brain there. White matter, and then the gray matter with the neurons. And I'm going to go over closer because this is just absolutely beautiful histology. Again, when you can appreciate normal histology, and this is an EGA 28 weeks, boy, it really sets it in perspective when you see pathology. This is all normal developing neonatal brain as I continue to cruise around. Very normal brain. And that concludes this discussion. Thank you.